how far has the coronavirus spread here in Africa? The number of COVID-19 cases and impacted countries in the continent has been increasing steadily. As of 20th April 2020, the entire continent, save for Lesotho and Comoros, had reported COVID-19 infections. But how do we know if the official figures are a true representation of the situation on the ground? Why are there so few tests in such large populations? Can Africa afford mass testing? Can social distancing still be achieved despite poverty, infrastructural challenges, and sheer indiscipline? This is The Breakdown, BBC Africa's COVID-19 special program, helping you make sense of the crisis. My name is Sharon Mashira. Let's start with some basic science. When it comes to contagious diseases, scientists categorize them based on how quickly they can be spread, and then they assign a number to it. This is called the basic reproduction number, or simply put, the term R0. This means the number of people that you can infect if you have the disease. The seasonal flu, for example, has R01, but COVID-19 has R02. So it spreads twice as fast and has proven to have way more fatalities. Testing allows us to get ahead of the virus through early detection. Testing large populations is termed as mass testing. This provides an opportunity for health workers to map out the level of the spread of the virus. It's this information that then informs the necessary public health measures that a country should take. Otherwise, we would be shadowboxing with a highly infectious and deadly disease.
Now, as we continue to identify who amongst us has the coronavirus, a serious challenge with testing many people at a go is the availability of test kits. You can imagine there's a lot of news on the same, but let's put that down and try to drown the noise. A few countries are now turning their focus to mass testing. Zimbabwe is one. As of mid-April, close to 700 people had been tested. The plan now is to test up to 33,000 people by the end of April. How exactly will Zimbabwe do this? Now, apart from the swabs and saliva tests, Zimbabwe also has a tuberculosis diagnostic tool that has been approved for COVID-19. This makes it quicker and is readily available. The first country to roll out mass testing was South Africa. So let's take a quick look at the numbers before and after mass testing, right? On March 8th, South Africa had 3 coronavirus cases. Fast forward a few weeks later, mass testing happens, and on April 16th, South Africa had recorded 2,605 cases. Over to another country, Ghana. Ghana has so far conducted over 50,000 tests. Out of those, only 1% is positive. They wouldn't know who to treat if those tests were not done. A similar case in Kenya. Mid-April, Kenya received nearly 40,000 testing kits. At that particular time, the confirmed coronavirus cases in the country were just over 200. But this number could go much higher with thorough testing. The kits themselves tested 8,500 samples in the 24 hours before the mass testing campaign was announced. Is this an African problem? Not really. Let's take the case of Germany that has been touted as an example to follow with mass testing. Germany has the capacity to carry out 500,000 tests a week, but they say that that number will increase to more than 1 million. The reason why we're saying Germany is an example is because for a country with a population of 80 million people, their death rate is under 1%. So one thing is clear. The fewer tests we do, the less data we have on COVID-19, and the less we know on how to combat the virus.
Globally, South Korea stands out because no matter how you choose to look at their numbers, they've managed to flatten the curve and lower fatality rates. Mass testing and contact tracing is at the heart of its combat strategy against coronavirus. Here in Africa, conditions are, however, more challenging. Testing equipment is still being developed on shoestring budgets, and health facilities are few and far between. These challenges notwithstanding, some countries have shown significant headway in their efforts at testing their citizens, but majority have relied on contact tracing, which is basically finding people who've had contact with positive cases.
South Africa's Health Minister, Dr. Zweli Mkhize, has stepped up processes in which people can be tested quicker than most African countries. We are at the National Health Laboratory Service at the moment. As soon as you enter the vehicle, the first thing you do is you wash your hands. At full capacity, they'll be able to process as many as 30,000 tests per day.
We've got 4 gene expert analyzers that can do testing within 45 minutes. With 4 in an 8-hour day, we potentially can test 128 patients in an 8-hour day. So just to have a look and show you, this is the cartridge that the patient sample would be put into the cartridge. The cartridge would then be loaded into the Gene Expert instrument, and once the cartridge is loaded into the Gene Expert instrument, we have results.
Gene Expert technology has traditionally been used for tuberculosis testing. It was recently approved for COVID-19 and can deliver results in just 45 minutes. Many describe it as a game changer, especially for hard-to-reach areas.
The vehicle as it is now can be deployed to anywhere within the country, whether they have electricity or not, in communities that cannot get out. We've got the 2 types of vehicles. This vehicle then assists in containing a community, as an example, where we could send the facilities to screen them wherever they are.
Getting tested only takes a few minutes.
Okay, we go on this side. For me, time out is first possible.
A clearer picture of COVID-19 infections will only emerge through large-scale testing.
The thing about mass testing is if you test 100,000 people, you'd end up getting so many negatives, which will then mean that you have not used the testing kits properly. And right now, not only Africa, the whole world, there's a shortage of testing kits. So what many countries are embarking on is screening their populations, especially where they have recorded a cluster of cases. And then from that number, they will be able to see how many of these numbers, if they test their samples, then they would be able to get people who will test positive for the COVID-19.
Limited testing has deprived African governments the full picture of the spread of COVID-19. Take Nigeria, for example. Africa's most populous country, with a population of about 200 million, has only tested 6,000 people. Or Ethiopia, that's only tested 5,000 in a population of almost 100 million people. Here is Mary Stevens from the World Health Organization. So straight off the bat, what challenges has Africa had when it comes to mass testing?
Right now, because of the challenge with the availability of the testing kits, so countries are mainly testing symptomatic patients or patients that fit into the case definition for COVID-19, but community testing is not a strategy that Africa adopted from the beginning of the outbreak, given the fact that the test kits are very limited on the continent.
Right, and do you think that there'll be more reported cases once we're able to roll out mass testing?
If you do mass testing, it's possible to pick those asymptomatic people, and of course you can easily isolate them and start monitoring or tracking all their contacts, so the people they might have come in contact with in the last 14 days. So it's easy to get these people and put them under isolation or self-quarantine as well, so that you can prevent further exposure of more people to COVID-19.
So is it therefore safe to say that accuracy with the number of figures is very dependent on mass testing?
I wouldn't say it's dependent on the mass testing, but what the additional benefit that the mass testing brings is that it helps you pick those people that potentially could be asymptomatic. But even if you're testing people that have symptoms, it's possible, yes, the figures you see that are fair representation of what is happening. And there is an indicator you can check actually in terms of the contact tracing. So if your country is monitoring all the contact 100% and the number of reported cases, so you look at the proportion of these new cases, whether they are coming from your contact list or not. This will give you an idea of potential cases that could be missed out there. So if you have like a large proportion of these numbers coming outside your contact list, so it's possible that you might be missing some cases. But if majority of the cases are coming from the contact list you have, it gives you the reassurance that you have most of the cases.
So if Africa is not able to, fully roll out mass testing, what does that mean for the spread of COVID-19?
If you look at the global situation, not every country has been able to do the mass testing, and this does not mean that it's impossible to break the chain of transmission. So even if that is a challenge, it is still possible to aggressively implement these public health measures. And now countries are moving to house-to-house case search, what we call active case search. So they look at hotspots and they go to people's houses in those hotspots looking for people that might present with COVID-like symptoms, and they test those ones. In addition to, of course, we said laboratory testing and isolation of this patient, aggressive contact follow-up and monitoring for the 14 days at least, and implementation of these preventive measures of hand washing, the issue of physical distancing, the cough etiquette, and the restriction of movement that countries are implementing. So if we implement this aggressively, we can still break the chain of transmission.
Evidently, mass testing makes the fight against COVID-19 more targeted and therefore more effective. However, considering that many African countries are yet to roll out these tests, Africa's best chance at containing the virus remains washing hands, staying at home, and maintaining a social distance. Has Africa been maintaining that social distance? Social distancing is hailed as one of the most important measures to stop the spread of coronavirus. Well, we've seen a few areas where it's been observed at individual levels, but also some instances where caution has been thrown out the window. Over in Ethiopia, in a market, people were spotted shopping in preparation for the Easter celebrations with not much social distancing. Over in Malawi, people gathered together for a protest against an anticipated lockdown, and social distancing didn't really cross their minds. But to achieve social distancing, governments across Africa have put measures in place, including closing schools, banning public gatherings, with many having to work from home. However, not everyone on the continent can afford isolation. In informal settlements like Alexandria down in South Africa, Makoko in Nigeria, and Kibera in Kenya, there's a worry that guidance around social distancing and self-isolation has almost been impossible to follow due to congestion.
A few miles from Nairobi's city center lies the sprawling slum of Kibera. Hundreds of thousands of people are thought to live here, struggling for food, for money, and for space.
Welcome to my house. This is where I'm living. We are living 7 people.
Joseph Acheng's house is like many here. It has some chairs, a stove, and somewhere to sleep. He knows how devastating a coronavirus outbreak would be in Kibera. Official guidance says, keep your distance, stay away from others, self-isolate if you show symptoms. But in a one-room house with no windows and a toilet shared with 25 neighbors, following that advice isn't easy.
My worry is, in case I'm affected, it is easy for me to affect them. From there, in this community, it is a congested. Population is higher than you are thinking. It is easy to get it from